Greetings everyone. I'm not sure if you can all see me or hear me, but if you can see me or hear me, you can just indicate. So my name is Andile Mkungo. I am a final year medical student. Oh, thank you. I am a final year medical student at the University of KwaZulu-Natal, and I'm part of the Internship SA group. So today we'll be reviewing one of the hospitals in Limpopo called Mokopane Hospital, and we are honored to have our guest here, Dr. Zulani Ramboda. She's a second year intern in Mokopane Hospital. So I'm just gonna let her introduce herself, and then we can take it after she has introduced herself. Doc, you can introduce yourself. That's Zulani.
Sorry, I got kicked off. So hi, my name is. Can you hear me? Can everyone hear me?
Yes, I can hear you.
Okay. My name is Dr. Ramboda. I'm a second year medical intern at Mokopane Hospital. Yeah, that's the introduction. I'm currently rotating in anesthesia. So I've done all the first year rotations. This year I've done psychiatry, orthopedics, and now I'm in anesthesia. Yeah.
Okay, thank you so much, Dr. Rambuda. If you don't have a problem, can I just not show myself because I don't know what is happening with my screen today. It's not looking very demure. So
That's right.
Dr. Rambuda, can you just please tell us if Mokopane was one of your five choices, and what were your other four choices, and which provinces did you choose? And maybe you can just tell us the criteria that you used when you're choosing your top five, because you might find that someone they don't even have an idea of how to choose their top five. Maybe you can help
Mhm.
them by just telling them the tip that you used, and what thoughts you had when you were choosing your top five.
Okay. So, I wanted to rotate in Polokwane or Mankweng. It's a complex, right? That that was my first choice, right? So since you have like five options, the thing is, if you want to be in a particular province, it's better to have three options in that province, and then you can have one in the other, in whatever two other provinces. So that's what I did. I put Polokwane as my first choice, and my second choice was a hospital in Tsanin, named Litaba. I didn't even want to go there. I didn't know anything about Litaba. I just wanted to go to Polokwane. And then Mukopane was just that third choice, that one that you just put there so that I can at least still be in Limpopo. And then my fourth choice was Rob's in Pumalanga. I don't quite remember what my fifth choice was, but it was something in Gauteng. I don't remember. Yeah. So it was one of my five choices, but it wasn't what I wanted. So when you apply, just make sure you're comfortable with all your five choices, because you can get any one of those. Yeah.
Thank you so much for that. Can you just please take us through about the location of the hospital? Where is the location, like where in Limpopo particularly, like specifically? And then you can also just tell us about the environment around the hospital, and then you can just after that you can just go to your rotation, and then just maybe about 4 minutes on each rotation and tell us how it went, what is expected from interns, how are the codes like, how are the doctors, what you need to do when you get there. Because should anyone get Mokopane, so they will be aware of the things that is needed from them as interns next day. So yeah.
Okay. So Mokopane Hospital is in Mokopane. It's in a township called Mahuelereng. So it's like 40, 50 minutes away from Polokwane. So from here, if you go further north, 40 minutes away is Polokwane. And it's like an hour 50 to 2 hours away from Pretoria. That's where it is. So it's quite a rural-ish place. Um, the place where the hospital is at is a township. It's quite rural. And then as you go up more, it's like a bit of a town. When you yeah, the town is like a town, it's fine. You have two malls, there's a Woolies food, there's Checkers, there's Clicks. It's decent. There's like Spur, but it's not in the mall. There's there's Wimpy, it's a decent place, right? But there's no like Uber, there's no Uber Eats or whatever unless you're staying in town. So here in the hospital you can only get delivered like Debonairs or Nando's, and that's pretty much it. So that's like the environment. Oh, and there's like a few gyms also in town. There's two decent bars that I know. Uh yeah. It's not much of a place where you can groove. If you're a groovist, I think you'd have to like go to Polokwane or go to Pretoria. But sometimes those two bars do have like decent events, if I can put it like that. So on to the rotations. I started last year with ONG. So I feel like it's quite organized. It's the most organized department, if I can put it like that. So here in this hospital, we have three consultants, and then we have multiple MOs. So a typical day consists of like at 8 a. Okay, let me tell you the stations, right? So there's labor ward, there is ANC and postnatal, and then there's gynae ward, right? Which is female surgical. There's just gynae patients in female surgical ward. And at times you have gynae OPD. I can't quite remember what day it is. And then you also have high risk clinic for the obstetric patients, I think 2 times a week, right? So a typical day, you get there at 8 for like the handover. So the team that was on call during the night is gonna present their statistics, like what happened overnight, what patients they have in labor ward, if they have any, and then you start with the consultant ward rounds in labor ward, and then after that you move on to high care, still consultant ward rounds. After high care, it's everyone breaks into their own stations, right? So there's no like consultant ward rounds in gynae. There's not like consultant ward rounds in postnatal or antenatal. Yeah. So the time I was rotating, there was four of us, and we were split between labor ward, postnatal, gynae, and I think there was two of us in postnatal. And then ANC, we would go here and there if you were in postnatal. So the interns' duties in obs and gynae include if you're in labor ward, you're gonna see all the patients that come in, right? And then you're gonna take a history, examine, assess, come up with a plan, and then you're gonna discuss it with your senior most times. That's how it's supposed to be, right? And then in postnatal, it's ward rounds and your ward work. In gynae, it's the same thing, ward rounds and ward work. There's almost always a senior that you can consult with. And then other duties include like preparing the slate and preparing the patients who are for op the next day or so. Yeah, I think that's all. And then the calls in obs and gynae, I feel like they're the most hectic calls. Um, okay, casualty is more hectic than gynae, but than obs and gynae, but they're quite hectic because there's always patients coming in, there's always emergency Caesars, there's always something going on. Yeah, I think that's it for obs and gynae. I don't know if anyone has any questions.
No, we can go to the questions at the end. So if anyone has a question, they can just put them on the chat and then we can go through all of them at the end.
Okay, so I can just go through the rotations.
Yes.
Okay. And then my second rotation was pediatrics. And I think we all know peds is just peds everywhere. The environment is the same. Like, however it was in whatever hospital that you are in, it's the same thing. You know, pediatricians are very strict. Um, so you can't be a ghost intern in pediatrics. You're going to have a problem. It's one of the places where you have to work really hard and you have to give your all. So here we didn't have, during our time there was five of us in pediatrics. So we didn't quite have formal teaching. We would be taught during ward rounds, and we would also have like mortality reviews where you'd learn, and also with pediatric OPD, that's where you'd also learn. So the stations are peds general ward, neonatal. In neonatal, the interns see low care and KMC, and you also assist in high care and ICU, but high care and ICU are run by the seniors. And then there's peds OPD, and then the last station is postnatal and C-sections, which I feel is the most hectic, right? But they prepare you because I think in the first week you do a course which is called Helping Babies Breathe, which is like a resuscitation course for like neonates, like what should happen if a child is delivered and they're not crying or they are blue or they are floppy, stuff like that. So I believe you are quite well prepared. And also you never go into like a C-section or anything without informing a senior. So there's always someone on standby if you are having any problems. Yeah. But all in all, I think postnatal and C-sections, which is one station, is the most stressful because if there's like a C-section at 7:30, because 7:30 is your time to get into work, right? That means you have to go in, and there's still electives during the day, and there can still be emergencies, and you still have to see the babies in postnatal, all of them. Right. So the calls in pediatrics, eh, they are not too hectic, but it also depends on the senior that you are working with. So generally, your duties during a call would be attending all emergency Caesars, right? And if there's anything in the ward, anything happening in the ward, the sisters are gonna call you, and if you're struggling, then you can call a senior. But sometimes, depending on who you are with, they can also ask you to like go see pediatric patients in casualty. They can ask you to like come help them in either pediatric ICU or neonatal ICU during the call. But it's not too hectic. And then my third rotation was general surgery. Um, I feel like general surgery is it's not a very organized department here. And if it's something that you'd like to specialize in, I don't recommend coming to Mokopane. So during my time, there were four of us, there were four interns, right? And we didn't have we didn't quite have MOs present uh, during the rotation. So what rounds were usually interns and the consultant. I think you can just imagine how that how stressful that can be because there's quite a lot to do, quite a lot of bookings to do, and it's hard booking things when you are a junior because whoever you are referring to, they're just gonna chow you because you don't even quite know how to present the patient and stuff like that. But as time goes on, you kind of get used to it. And then I feel like with general surgery is one of the draining departments here because you kind of see how the healthcare system in this province particularly is failing because yeah, this place, it's like far, far, far from the ideal because sometimes there's no surgeon on call. Emergencies, you have to divert to Bulukwane, and sometimes they're like, no, it's not an emergency. You have to keep the patient for the patient to be seen the next day, even if it's like acute abdomen or something like that. Yeah. And there's always delays or difficulties with booking emergencies most times. Like if you have to do a lab during the night. There's only like one anesthetic MO, and most of the time they'll be in maternity theater. That means that patient has to wait until they're done with whatever case they're doing that side. And then also, you know how most general surgery patients will require like advanced imaging. This is a regional hospital. We do x-rays. Last I checked, our CT was not working. Even if it's working, you have to like get approval from a radiologist in Pulukane to do a CT. Anything else, you have to transfer the patient that side. You still have to talk to the radiologist to book. You still have to talk to the EMS to come get the patient, which 50% of the time they don't even come. So yeah, that's a lot. So with calls in surgery, since I had so here's the thing, right? In Mukopane, you do departmental calls in obs and gyne, in pediatrics, and in anesthesia, right? So since I had done obs and gyne and peds when I was doing general surgery, I could do casualty calls, peds calls, maternity calls, and ward calls. So it's not like I'm gonna be doing gen surg calls, right? So I could be rotating in general surgery, but I'm on call for maternity. I could be rotating in general surgery, but I'm on call for peds. That's how it was, or casualty or the wards. Yeah. So peds not too hectic, maternity kind of hectic. What calls most of the time not that hectic, unless they're like multiple flagged patients that you have to be seeing throughout the night. Maybe someone with DKA where you have to be doing blood gases like 2 hourly or so. That's way kind of hectic. And then casualty calls are just always hectic no matter what. And then my fourth rotation was internal medicine. So if you are interested in learning, like you will really learn in internal medicine here. There's like the doctors are the best team of doctors here. So there's two consultants. One sees female medical and the other sees male medical. And there's also medical OPD twice a week, right? So in the one ward in female medical is one consultant and two MOs, and then because there were four of us, there'd also be two interns, and then that was female. It's the same thing for female and male. So we have two physicians. We don't have like sub specialities. So if it's like if you need a cardiology consult, you will have to like refer to Polokwane, that kind of thing, right? If you need if you need like renal, if you need stuff like that, you would have to like um refer to Polokwane. And then the calls, it's the same thing with like gen surge. Since I had done peds and maternity, I could do calls in peds, calls in maternity, calls in casualty, or calls in the ward. Yeah. That's it for the first year rotations, right? And then for the second year rotations, I started in psychiatry. Uh, so the psychiatry ward is just one ward, which has a side for the males and the females, right? So Mondays in psychiatry is grand ward rounds, Tuesdays and Thursdays are clinics, and then Wednesdays and Fridays you thoroughly see the inpatients and you see the patients for leave of absence. That's basically it. And it's quite a nice working environment in psychiatry. Everyone is very considerate of each other. And there's two presentations every week from the interns. And it's not hectic. No one is like no one is after you. No one is like I don't even know how to put it, but like it's a very nice working environment. Even the teaching sessions are very productive, if I can put it that way. And then my second rotation this year was orthopedics. So with orthopedics, you have two orthopedic surgeons, right? And then you have a number of MOs, right? So with orthopedics, you will either have a good time or a bad time. There's no in between. It depends on like who you are working with between the two consultants. Yeah. So if the let me just put it like that. It depends on who you are working with. And if you are not working with the one that you get along with very well, it can be very frustrating. Because when I went into orthopedics, I thought I wanted to specialize in orthopedics all this time. Coming out of medical school, I thought I wanted to specialize in orthopedics, and then I get there, and now I am not quite sure anymore. Like yeah, things just got hectic. So with orthopedics, Mondays it's ward rounds and Mondays, Wednesday, and Fridays it's theater days, and then there's also ward rounds on Monday and Friday, and then on Tuesday and Thursday is consultant ward rounds, and then there's also orthopedic clinic on Tuesdays, Wednesdays, and Thursdays. Yeah, but during my time in orthopedics, the main theater was being renovated, so we didn't get much exposure in terms of like procedures. Because I think for only the first week or the first 2 weeks, the theater was functional, and then after that, the theater was being renovated. So we could only do like emergency cases in like a nearby hospital. And then there's like a formal teaching or presentation on Wednesday, which is prepared by either the intern or the MO. And the last rotation is anesthesia. I just started like this week. And since the main theater is not working, we're literally just doing maternity cases. Unless there's like emergencies, then we do them in like a nearby hospital. But so far it's fine. Yeah. So that's where I am right now.
Thank you so much. That was very, very detailed. Thank you so much. And Kosiami, I'm sorry about your orthopedics experience.
It's fine. It's fine.
So I don't know if maybe one of your colleagues have told you about how do you guys do family medicine, but if you have any idea of how like family medicine works in Mokopane,
Mm.
then maybe you can just tell us a little about it, even though you haven't been interested in it.
Okay, so what I know about family medicine is that there is four stations, right? So there's casualty, which I believe you do it for 2 months. There's general OPD, which I believe you also do it for 2 months. And then there is clinics, which is like clinics that drain to Mokopane. You do those for a month. And then there's the nearby hospital called Fort Reker. You work there for a month. Yeah. The thing about our general OPD, it's not a booked clinic or anything. People could just be coming from work and just pop by. So it's always full. Um Most times they don't even finish. Like it gets to past 5 and then they have to send the patients to casualty to be seen there. Yeah, that's what I know about family medicine.
Oh, okay. Thank you so much. Thank you so much for this and just taking us through all of your rotations, the one that you have done also with family medicine. For someone who's not born and bred in Limpopo,
Mm.
can you just please tell us what is the predominant languages, especially around Mokopane, and then if someone is not like does not speak that language, are they able to survive Mokopane?
Oh, okay. So people here speak Sepedi. I'm also not fluent at all. So, like 80% of the time, I'll speak in English. So it's fine, but you'll just have to try because obviously you'll get patients who don't understand English at all. But there's always someone there. Like you could ask someone to come interpret for you. But you can survive on your English. It's fine.
Oh, okay. Thank you so much for that. So, guys, you have heard about our rotations and the work environment in Mokopane Hospital. So, if you have any question that you think maybe Dr. Rambuta didn't cover, then you can just put your question on the chat. So then we're gonna check on those questions at the end. So, the second question that I have for you is about the
Mhm,
DQ. So can you
mhm.
please tell us if Mokopane offers the DQ, and if they do offer the DQ, is it within the hospital or outside the hospital? And then you can just also tell us about if you leave at DQ, do you think a car is really a need as a first year, even as a second year intern, or you can just survive without a car? So if you don't have a car, how can you survive? Are there any Ubers around that you can just be able to move around with? Or
Okay, so yes, Mukopane does provide the queue, right? So it's 2 bedroom houses you share with someone else. So it's 2 bedrooms, 2 bathrooms, a kitchen, sitting area, and like a tiny dining area, which is like combined. It's like a home in a way, but the thing is the houses are quite poorly maintained, right? So the previous people, like where I live right now, the previous people are the one who repainted the place and made it look a bit decent. Nyana. It's quite poorly maintained. It is within the hospital, right? Um, about whether you would need a car. So there are no Ubers, right? But there are taxis, and there are also like maxi taxis or like private cabs, if I can put it like that. The roommate that I lived with before, the person that I live with now, she finished her internship without buying a car. So I guess it's doable. But I bought a car in the first month. I just couldn't do it. Yeah.
Oh, okay. Thank you so much for that. So, with regards to the DQ, do you guys pay for your electricity or you buy your own electricity? So is it pre-prepared or prepared electricity?
No, everything, when your pay slip comes, everything is already deducted. But I must say, it's quite a lot of money compared to what other people are paying in their DQs. Because as far as I know, other people get deducted like 900 rands or something like that. We get deducted like 2.4, 2.5. I feel like that's a lot. But yeah, you don't have to pay extra for anything. And I must say, right? Um, so this is a township, right? So it's safer to stay in the hospital. And also there's like water problems in Mokopane. So in the hospital, at least you always have water. And if there's like load shedding outside, you guys don't get load shedding. So I guess it's better to stay in the hospital, if I can put it that way.
Oh, okay.
Mm.
For someone who doesn't want to stay in the DQ, obviously for their own reasons, are there any good places that they can rent around Mokopane?
I have heard that there are places, but I would be lying. I would really be lying. I'm not too sure. Yeah, I'm not sure. Maybe in town, there probably are places in town, but it's not like apartments as you would get in the cities or whatever. It's like it's like houses.
Oh, okay.
Mm.
Maybe they can also check on private property. Maybe they can
Yeah,
find something
yeah.
there.
Mm.
Okay. I think that all from me. Then, if anyone has a question, obviously they can put their question down. Then we can go through them at the end. So, my third question, of which I think most of us we are interested in knowing.
I know this one.
You know
I
it.
know it.
So, so it's the salary. So we want to know how much you guys get at Mokopane Hospital, and is it inclusive of rural allowances or danger allowances or inhospitable allowances? So you know those allowances. So do you get those allowances? So maybe you can just tell us about how much is the overtime and everything.
Um, I know we get 18% for rural allowance here, right? I'm not sure how much it adds up to, but your your take home after everything, after like they take the tax, after they take your what do you call it? Your amount for DQ, after they take for like lights and electricity and water and everything, it's nicely it's above 50.
Oh, okay, okay,
Yeah.
okay. So it's about 50 guys. So that's
Yeah.
a very, very good money compared to what we are getting now. So you just have to check that as well.
Yeah, yeah. I feel like it's quite a very decent amount. Also considering that this is not as busy as a tertiary hospital. like you're not working like as, how can I put it? It's you get a bit of rest during your calls. You have those calls that are quite busy, but it's not as bad as a tertiary hospital. So I feel like it's enough. It's decent.
Oh, okay. And
Mm.
I wanted to know that how many interns they take in per year at Mokopane.
Um, During our year, they took 20, I believe, ne? But this year, I think they took nine or 10. So I believe next year is also going to be the same number, around 9 or 10. So it's like, what, three interns per rotation, given that maybe there's asynchronous interns who are like second years, but still doing first year blocks. Yeah.
Do you know maybe is there a reason why they took so much like so less number this year compared to 2023?
I'm not too sure, ne? But I heard something about the Cuban program being discontinued or something like that, or just not having enough number of doctors, something like that. Yeah.
You
Yeah, and it seems like it's gonna continue like that even next year. But it's not. Okay, so last year, before all of this, before they halved the number of interns, right? We were doing 4 calls every month because there were enough of us to like cover the roster, right? So this year we are doing 5, and rarely you could get a six. I've never gotten a sixth call, but 5 is the standard number of calls, right? And also last year, we used to have an intern on call for anesthesia every day, but this year, it's not every day. It's only the people who are rotating in anesthesia who can do anesthesia calls, just so we could cover the other stations.
yeah, it sounds bad, but not that bad.
Yeah.
I mean, I think you can cope with that as well.
Yeah, we've adjusted. It's quite okay.
There's something that came out in my mind now with regards to the rotation. I'm not sure if you've mentioned it or I didn't get it, but I
Okay.
wanted to ask that were you able to cover or do 10 sections as per HPCSA when you're doing your obs and gyne rotation?
Yes,
Oh,
yes. Here you will definitely get more than your 10. Yeah.
oh, okay. Okay.
Yeah.
So, my last question is about the quality of life, of which you have touched on, Liton, but I think you can also just elaborate or, yeah. So we want to know that how much of your life does internship take up or take from you, and then how much do you have? Okay. Do you have any space time that you like get during your internship? I think with the number of weekend, with the number of okay, let me not just say that. The third one is how many weekends do you get, like weekends free do you get per month?
So the nice thing about this hospital is you choose your calls. You choose when you want to be on call, right? The only thing maybe is that they can adjust because maybe you chose the same day as someone else or they need to cover what. So what I usually do is I do my calls back to back, like Monday, Wednesday, Friday, Sunday, and then maybe Monday or Tuesday the other week. So that means I would have covered all my calls within like one week. That means I get 3 weekends off. So on average, you could have 2 week. I feel like everyone, I would say, gets 2 weekends off. And then if you plan your things nice, you can get 3 weekends off. And it's not, you still have a normal life. You come back from work at 4:30. I go to the gym almost every day. You can come back and study a bit before you sleep and go to work the next day. It's not, you're not strangled or anything. Yeah.
Okay, that I think that covers all my questions that I had for you, and then I think we can just go and answer the questions that are on chat. I don't know if you can see the questions from your side. If you can see them, you can just answer them. But if you can't, I can read them for you on my side, and then
Yes. Could
oh,
you please just read them? Mm.
okay. So, the first question is from Muketwa Rachilin Ghana. So, the question says, does the hospital have supplies and do equipment work, or you have to be a mechanic and invent things?
What do you mean equipment? Like in theater or
Uh, um, I think I'm not sure if Mukeso is she or he, but I think they wanted to ask about the resources. If you guys are fully resourced and everything,
no?
and then you have to try and find your own way of making things work.
Um, you know, I'm trying to think. I wouldn't say we're fully resourced, Shem. We lack we lack Shem. Sometimes your blood gas machine is not working. Like I said, the CT scan is not working. Um, Currently, the X-ray department has moved to another building because they are renovating. There's just like a lot going on. Sometimes you don't have strapping to secure your IV lines, and you have to use like what do you call the post-operative cluster thing, like the Primapo. Yeah, we're not we're not. I hope I'm answering the question right.
For me, I think you are, but if maybe Mukesa is not satisfied, they can just unmute and then they can just verbally ask the question.
Mm,
So yeah. And then Muketa, are you satisfied?
Hi, yes, I am. Thank you.
okay.
Okay, okay. So the second question is from Tandoyenko Singwenya. She's asking how far is the hospital from Pretoria? How many hours drive? So
It's
from Moko.
true, Max. 2 hours from Pretoria, yeah.
Okay. Oh, should they put me in Mokopane? I want it to be like an hour.
No, 2 hours. Sorry.
The third question comes from Penelope Makura. She's asking, hi doc, does the thing of cutting of hours for doctors in Limpopo applies to interns as well?
No. It applies to ComServes. So what I know in this hospital, they only do 2 calls, which is like 48 hours overtime. It's 2 weekend calls. But in other hospitals, they don't have overtime at all. Some are working shifts, which is like you work 12-hour shifts, 15 days a month, and that's it. Some other hospitals have their ComServes doing calls but not getting paid for them. They just get like rest days off.
Okay, wait, I have a question with regards to this thing
Mhm.
because I didn't know about it.
Mm.
So with regards to this thing of cutting hours, so do they still get the full overtime money or
No,
Oh
No,
my
no,
gosh, that's
no,
terrible.
no. You're not getting your overtime money. No, you're
Oh
just
man.
getting, yeah.
Yo, yo. Okay, no, this is not good.
Yeah, no. So I don't think it's wise to do your ComServe in Limpopo right now. But
Mm,
internship, I guess it's fine.
I know, I'm running away. I need to. Okay, the last question is from Andy Santembe. The place where the hospital is located, is it safe in general? How is the competition for interns intake? So I think with the regards to place where the hospital is located and the safety, she did cover that in the first slots of the conversation. So we'll just upload the video on YouTube and then you can catch up on that later. And then how is the competition for interns in tech? I think you can answer that question, Doc.
No, you're not competing with anyone to get placed in Mokopane, I believe. Like I believe if you put it as your first choice, most likely you will get it. Because out of everyone that I've met, I've never met anyone who chose Mokopane as their first choice or anything.
Mm.
Yeah.
I think Penelope says thank you, Doc. I think she's answered. And
Oh,
then Andiswa, I hope you are answered as well. So if you're gonna go to Mokopane, even if you put it as a first choice, you're not competing with anyone. And then those are all the questions that we had. So because we still have about 12 minutes before our thingy. Oh, okay, there's someone who wants to ask a question.
okay.
It's Melissa. Melissa, you can just unmute and then you can ask your question.
Okay, thank you. I just didn't hear it clearly when it comes to um internship. So in internship, do you get your in terms of your salary, do you get full payment including overtime, or you don't get overtime in Limpopo currently?
No, in internship, you get your overtime.
Okay, thank you. So the only
Yeah.
problem or the issue is with the ComServe.
Yes. And with ComServe also, it varies with hospitals.
Okay, thank you.
Yeah.
Mm, if there's anyone who wants to answer question as well, they can just unmute and and ask their question. It's gonna help you guys. So you can just unmute and then ask your question. Okay. While they're thinking of raising their hands or just unmuting,
Mhm.
just please share a word of wisdom with us since next day we are going to internship. A lot of things they're gonna change. Some of us they're gonna move from um one province to another province, just like me. Um, living KZN. I've been in KZN for 23 years now, so I'll be leaving KZN next year. So, that change is not like an easy change or just, so can you just please share a word of wisdom with us and also how to cope with the things that are happening in internship? Because internship, I've heard from many people that internship is not really like smooth journey, like it's a roller coaster journey. So, what coping mechanisms or coping skills can we use when we get there next year?
I think you have to have support. I think it's always nice to have a friend or two, someone who is also in internship, someone who's going through the same thing as you for support, right? And I also think it's nice or it would be beneficial to have hobbies outside of work, something that you do. You shouldn't just be a work home, work home, work home kind of person. Find something that you would like to do in the area that you are in. Like I don't know, you could I don't like I just go to the gym. um I know people who go fishing, people who go play tennis, people who have like other things. Just find something to do where you are. Find hobbies. I think I think that's pretty much it. And don't neglect yourself. Like I know, I don't know. I've heard in bigger hospitals, people make you feel guilty for taking like a sick day off or something. But if you need a sick day, take a sick day. Don't force things. Yeah,
I think you guys had that. I had that shame. I had that.
I've heard. Yeah.
I know I'm gonna take so many sick days. Wait, so how many sick days do you have to take or you are obliged to take for the whole year according to HPCSA?
I think it's 11.
Hmm.
Yeah, but also, um, you can't take more than what is it, 5 or 6 in a rotation, or else you have to repeat the rotation because you would have also taken an annual leave again.
Oh yeah, it makes sense though, because
Yeah.
okay. And with regards to leave at Mokopane Hospital, do you guys get to choose like when do you want to leave or they choose for you?
No, no, you choose. Here you choose for yourself. So it's between you and the people you are rotating with. So obviously two interns can't be on leave at the same time unless it's like an emergency thing, like a sick leave. Someone takes a sick leave while someone else is on annual leave, right? But you choose. So between the 4 of you or the 5 of you, you're like, I want to take leave at this time, and then the other one chooses, and so on. So with my group, if I choose first this rotation, the other person chooses first, the next, the other person chooses, just like that.
Okay, I feel like that's the nice thing because
Yeah.
if they choose lists for you and then they get you dates that you maybe don't need and then the ones that you need now you can't go and leave. Okay.
Mhm.
I think it's a good thing that you guys able to choose leave for yourselves. And then there's another question on the chat. It says it's from Sarah. It says, apologies if I've missed this. Does Mokopane have registrar?
No, no. It's interns, MOs, and consultants and comsers and consultants. There's no registrars here.
Okay. I hope Sarah, you are answered. Um, I don't see any questions. I think most of the people are watching Pirates and Kaiser, so
Yeah, I
they
think
might,
so too.
I'm sure they might. Oh, there's another question. It's from Edu Leo. Leo. It says, I initially wanted a bigger hospital, but I'm not sure anymore. Any advice on small versus bigger hospital?
Honestly, I'm not too sure what goes on in bigger hospitals, but I feel like here you get much more hands-on experience, if I can put it that way. Because, like, obviously, you're not competing with registrars for any procedures or anything like that. So you do get to do like amputations. It's you and the consultant is assisting you. You do get to do procedures that interns in bigger hospitals might not be able to do, like your 10 c-sections. I don't know if I have a friend who is rotating in Polokwane. She did not get her 10 scissors. I don't think she even did 3. So here you get to actually be there.
Okay, so in summary, if I get you, it's not really an academic hospital since there are no registrars and it's just a smaller hospital. So it's mainly for a person that wants to be like hands-on and be exposed clinically, rather than for someone who wanna be like academic and also have hands-on experience.
Yes, I could say that, but it's also quite dependent on who you are doing the rounds with that day, because some people teach and they will give you homework and then you come back and rediscuss and stuff like that. And then recently also the hospital has like put, I don't know how to put it, but like they have made it compulsory for every department to have like teaching sessions at least once a week.
That's very nice. That's very nice.
Yeah.
I think in E2 was well answered. It's they're saying thank you on the
You're
chat.
welcome.
Okay. I don't have any further questions, but I'm sure someone here or someone who's not even here, there's maybe someone here that's scared of asking questions in a public platform. So do you have any social media account? Maybe Instagram, Facebook?
Fortunately, I don't have any social media. I'm literally either WhatsApp or email. That's it.
Mm.
My
But
email
friends,
is my name and surname at gmail.com. That Zurani Rambuta at gmail.com. That's it.
I shame no friend. I can see that you're not bringing your Instagram back.
No, it's not coming back. I think it's been what, 3, 4 years now.
It's been 4 years. It's been 4 years. Oh
Yeah.
no.
Yeah.
So I think if anyone has a question for Mokopane, then you can just DM me on my WhatsApp.
Yeah.
Then I can share a number at the hotel. And
Yeah.
then there is another question that just popped in now from Idu. Last question. The dominating language there is CPD.
Yeah, it's a bit.
Okay.
Mm-hmm.
You know, I've been for the past few days, I've been trying to learn those languages, CPD.
What skim sam?
Yes.
Yeah.
So yeah, guys, I think this is the end of our interview with Dr. Rambuta, and I would like to thank you so much for honoring our invitation as the Internship SA. And actually, you took your own time, and then you came and then you talked with us, you shared with us the insights and everything. We would like to appreciate you. Thank you so much for that. Thank you
Thank
so
you for
much.
having me. Thank you so much.
You are welcome.
So,
Then, guys, this will be uploaded on YouTube. Then you can just check it out YouTube maybe later on. If you're just struggling with choosing the hospitals and everything, you can just re-go back to it again. And then, yeah, as I've said, if you have a question for Dr. Rambuta, you can just DM me. And then I can give you her number. I think, yeah.
all right. Thank you.
Thank you, friend. Bye.
Bye.